6, and I live in Rockford, Michigan. Years ago I was having some very severe headaches, and for years I actually suffered from migraines. And when I met my husband, Donald, he kind of pushed me to start seeking treatment. And so I went and did a lot of different things, chiropractic and biofeedback and a lot of different things, and nothing was quite working. And he pushed and pushed and said, before we get married and have kids, you really need to seek some treatment. And so I found the Mary Free Bed Headache Rehabilitation Program, and I was scared to commit to what I thought was going to be a very intensive program, but it turned out to be absolutely amazing. It was easy. The staff were friendly. I felt instantly at home. When I would go on a weekly basis and get help, and I would have physical therapy treatment and counseling treatment and medical treatment. I met with a doctor, and when I had begun the treatment, when my headaches were bad, I was going to the emergency room once per month, and with a severe migraine where I was completely unable to function. I couldn't work, I couldn't communicate, I couldn't do anything. So when I started the program, I was very excited to get the help. I was nervous about the time commitment, and the time ended up being a time of relaxation and stress relieving, because I actually had a chance to kind of decompress and think about where I wanted to go with my headache future and how I wanted to manage my health. So they helped me really think through how I wanted to do that and take control of my life again. And instantly, I think I had one migraine in the first 9 months after I started the program. And it was not even as severe as I had in the past. So I instantly saw success. The staff were just really anxious to get to know me as a person and help me become healthy. So it was really nice to go. And they offered support groups if you wanted to go to additional things and therapy. And I was driving from out of town, so I couldn't do any of that. So had I been in Grand Rapids at the time, I would have taken advantage of even more of the opportunities in Mary Free Bed. The therapy that I had at Mary Free Bed was amazing. I would go in and actually have a trainer work with me for the physical portion of the time, and she would stretch me. She taught me a lot of relaxation techniques. So I would bend and rotate my neck, and I still use. I can't tell you how many years, and I still use all of the techniques. She taught me diaphragmatic breathing, and would practice that 20 minutes a day. And when I would get there, I would demonstrate how I had practiced the techniques, and she'd say, "Come on, Amber, you can do it a little bit longer," or "What if we would use this technique in conjunction with this technique?" And so I would practice different things. I then sat with a counselor for about 45 minutes, I think every other time I was there, and would talk about how I was dealing with the stress in my life and what the stress points were. And I quickly realized that what I thought the stress points were not the stress points. So she really helped me figure out, for someone who's a type A personality and manages other people and manages projects very well, I realized I wasn't managing myself very well. And she really got to the root of what I really needed to do differently. And then I would meet with a doctor, and he would talk about the medications that we were trying. And our goal was to get me off most of the medications. I had been on preventative migraine medications for years. So he took me off those, but also gave me some options so that I didn't feel panicked that if I did have a headache, I was going to be without something that would help me. So he was a wonderful advocate, and the counselor was a wonderful advocate. We then tried a little bit of biofeedback, which really fed into the other pieces. And when I had tried biofeedback before, I don't think I had the full picture of how it fit into the larger portion of health management. And so this time when we tried it, we had great success. And overall, I really learned to relax. I realized where I hold tension is in the muscles in my shoulders and in my neck, which as I talk to other people, they always say, "That's exactly what I feel." And so I felt like I had a real opportunity to both figure out how to release the help or release the stress and figure out when stress is coming on, what to do differently. So I manage stress and I manage myself very differently. Yes, I saw Dr. O'Connor. Dr. O'Connor was wonderful, very helpful and very challenging. Definitely wanted to make sure that I met my full potential in using the things that I needed, but nothing more. So I really appreciated that proactive approach. I remember before I started the program, I remember I rented an apartment in Kalamazoo, and my husband, my boyfriend at the time, came over, and I was laying on the floor, and he said to me, "I'll take you to the ER, but you gotta commit to doing the Mary Free Bed program." And at that moment, I was, in a weakened state, and I said, "Fine, I'll do it." And when I started feeling better the next day, he said to me, "Amber, you really need to be serious about this, and you gotta commit." So I went and I interviewed with the program to kind of check it out. And I came home and I told him, what it was going to be like, what the costs were, which my insurance ended up covering the entire cost of the program. So I thought that was absolutely amazing. We had decided to commit out of pocket to it, not knowing whether the insurance would cover it. And I came home and started talking to him about it. And he said, it's such a holistic program. It has everything you need. You can tell the people care about you. How can you not try it? And 6 months later, I was completely migraine free. I now sympathize and empathize with migraine sufferers just unbearably. I can only imagine what they're dealing with, and we're constant advocates for the Mary Free Bed program, for the headache rehabilitation program in the pain center, because we think it is an absolute must for anyone who suffers, and people there will